Hi, this is Dr. Jennie Byrne from Cognitive Psychiatry of Chapel Hill. Today I'm at Holly Hill Hospital in Raleigh, North Carolina, and we're going to talk with Dr. Dunn, who runs the ECT, ElectroConvulsive Therapy unit here.
I'm Dr. Lawrence Dunn. I'm the director of the ECT program here at Holly Hill Hospital. ECT is a non-pharmacologic treatment for treatment-resistant depression or bipolar disorder or psychosis. ECT uses an electrical stimulus to induce a seizure, which treats the mood disorder or psychosis. Candidates for ECT are people who have generally failed several treatment trials with medications. The ECT process takes place 3 times per week, usually for 6 to 12 treatments before remission from the illness is achieved. Once somebody has successfully completed a trial of ECT, they either return to outpatient treatment with standard pharmacologic agents, or they can go on to maintenance ECT where the treatments are delivered semi-monthly or monthly. When a patient comes in for ECT, they generally start in this area here. This is the pre-ECT area. Here a person comes in and is evaluated, their vital signs are monitored, preliminary interviews are done. Then an intravenous line is started, and once the person is interviewed and stable, they move to the ECT suite where the procedure itself is done. This is the ECT suite where the procedure is actually done. We have an anesthesiologist here who's present throughout the procedure. The person is brought in and lies down here. The anesthesiologist induces a general anesthetic, so the person is unconscious throughout the procedure. The entire procedure takes about 5 minutes. The anesthesia is induced, and then this is the ECT device that's used to provide the electrical stimulation. We record electroencephalographic tracings throughout the procedure to monitor the patient's response. The ECT procedure itself takes between 20 and 120 seconds for the seizure itself. Generally, people wake up from the anesthetic within about 5 minutes of the procedure ending, and after about 10 or 15 minutes of recovery, are ready to leave the suite. The individual experience is basically that they fall asleep under anesthetic and wake up feeling relaxed and somewhat better generally. A primary side effect issue with ECT tends to be some mild memory loss. Now, typically in the past, memory loss has been somewhat more extensive because of the way the procedure was typically done. Modern ECT machines use a micropulse stimulus that minimizes the amount of energy delivered to the brain. This results in much less memory loss than was typical even 10 years ago. However, mild memory loss still does occur with the procedure. The memory loss is typically limited to the time right around when the procedure is being done, although there is some possibility of longer-term memory loss that is uncommon but can't be ruled out. Once the ECT procedure is complete, the patient will wake up generally within a few minutes. On waking, they're generally somewhat groggy and disoriented, primarily because of the anesthesia itself. People stay here in the unit for about 45 to 90 minutes recovering and are generally able to leave to either return home or go back upstairs to the inpatient unit afterwards. The anesthesiologists ask that people not drive for 24 hours after the procedure, and we generally require that somebody have supervision for at least several hours after leaving if they are going home after the procedure. ECT is a remarkably effective treatment for depression. The response rate is on the order of 90%. People generally respond very quickly. We often see a clinical response within the first 2 or 3 treatments. A typical treatment course is between 6 and 12 treatments. As we mentioned earlier, once remission is attained, people can return to standard antidepressant treatment or have outpatient ECT on a maintenance basis. People can take medications such as their antidepressants while receiving ECT, so stopping medication isn't generally required. There are relatively few contraindications to the procedure. Active brain disease, such as a stroke or a brain tumor or unstable cardiac disease, would be contraindications. But generally, the procedure is safe even for relatively ill people. Some elderly people who are too ill to take antidepressants can receive ECT instead. Women who are pregnant who want to avoid medications during pregnancy can use ECT for treatment as an alternative, which is considered safe in that setting.
Hi, I hope that was helpful. We got a little tour of the facility from Dr. Dunn, learned a little bit about ECT. Please see the resource section for more information. Thank you.